Overworked and tired nurses around the country say that they continually face long hours as they care for our aging population. Here in Ohio, nurses appear to have an ally now in State Representative Robert Sprague out of Findlay. He's introduced a bill now that would make forced overtime illegal in the state. 9 News Side reporter Jay Warren took a look into the issue today and has the story.
House Bill 456 aims to stop mandatory overtime for nurses. It's something that the Nurses Association wants badly and something the hospitals do not, saying that they need the flexibility to properly staff.
Nurses who argue they are overworked say it boils down to safety. The longer they work, the more likely they are to make a mistake. Kelly Hickman Begley is a labor and delivery nurse.
Nurses in the hospital work usually 12-hour shifts. Sometimes they don't get a bathroom break. Sometimes they don't get a lunch break. And then at the end of their 12-hour shifts, they're being made to stay for an additional 4 hours.
Representative Robert Sprague, Republican of Findlay, introduced the bill.
In some cases, they're forced to work, a normal shift, and then they're forced to work another shift on after that normal shift, which, they're tired, they're exhausted, they're burned out, and it affects patient safety.
The Ohio Hospital Association opposes the bill and says in part, quote, the legislation improperly assumes that all nurses share the same skill sets and are simply interchangeable parts in the treatment of patients. Hospitals must have the flexibility to respond to the dynamic state of patient needs. Sarah Bolton is Director of Programs and Services Operations for the Health Collaborative, a Cincinnati-based think tank. Among other things, her organization is trying to address staffing shortages.
We at the Health Collaborative have a number of initiatives focused on workforce, specifically on building a strong pipeline from our community, so working with high school juniors and seniors.
In the meantime, this is a bill that the Ohio Nurses Association fully supports.
Just like with pilots, truck drivers, train engineers, there's a reason why some vocations have limits on hours and fatigued work, because what we do really does impact not just us, but the individuals that we care for.
If this bill were to become law, it would make Ohio the 19th state to make it illegal to force nurses to work beyond their normal shift. Jay Warren, 9 News Side, Corryville.